Today I want to talk about why I believe shared decision making at a state health policy level is going to become increasingly more important. And this is regardless of what happens with ACA in terms of whether the Supreme Court either strikes it apart, or essentially upholds it. And the four reasons are, the first is an overwhelming ethical imperative to do the right thing. The second is it is perfected informed consent, and we have an opportunity to align, or shall I say correct, the current drift in informed consent. The third is there is advancing evidence or emerging evidence that suggests that this is a way to help disadvantaged populations. And the fourth is the issue around, will this in fact impact quality and costs, which states will become increasingly more important with, especially as they have an increasingly larger Medicaid burden. I want to talk specifically about two reports that have been issued in the last couple months. The first is a report out of the National Academy of State Health Policy. It's a very comprehensive overview of all the state initiatives, everything from embedding shared decision making in health exchanges to suggesting that shared decision making by contract can be part of Medicaid contracts, to states that have taken the bold move, as Washington State did, in terms of promoting shared decision making through a mandated pilot project. These are all very interesting kind of initiatives, and there's growing interest. Oregon, Washington, Maine are all states that have various pilots underway, and Minnesota and other states are considering it. So I think that's important. The second is a Kaufman report called Valuing Healthcare, Improving Productivity and Quality. It was a white paper that emerged out of a group that was brought together by the Kaufman Foundation. And these are all thought leaders in terms of, are there things we can do now that are going to be innovative, improve quality in healthcare? And they've devoted a whole chapter to shared decision making, suggesting it is a way, in fact, to improve healthcare for populations and make it much more patient-centered. So those are articles that exist on our website, and I would urge the viewers, if they're interested, to take a look.